and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you today. Dietary salt in Indian diet, a serious risk factor of hypertension. Hypertension is a serious threat globally. Organs such as the brain, kidneys and heart are significantly affected by an increase in the blood pressure, and surprisingly, most of the hypertension cases are in low and the middle income countries. Several studies have revealed that the mean salt intake among the Indian populations ranges between 5.2 to 42.3 grams per day. A recent study in the clinical nutrition suggested that the salt consumption is high in India. People all across are recommended the same cutoff value of dietary salt consumption, regardless of the diversity in dietary patterns and environmental conditions across the country. Consumption of fruits in mid-pregnancy associated with risk of gestational diabetes mellitus. As we all know it, gestational diabetes mellitus is characterized as a new onset of impaired glucose tolerance during the pregnancy period, which can have implications in both the mother as well as the fetus. Now, to determine the potential association between mid-pregnancy consumption of fruits, vegetables and even fruit juices, also associating the risk of gestational diabetes mellitus, an observational study was conducted and later on went on to get published in the Clinical Nutrition Journal. The study concluded that the findings indicated that appropriate quantity of fruit and vegetable intake throughout the pregnancy period may have a beneficial effect on preventing the development of gestational diabetes, whereas excessive consumption of fruits, potatoes as well as fruit juices is associated with an increased risk of gestational diabetes. Obesity and its impact on hospital mortality in COVID-19 patients. Obesity has several adverse effects and is the fundamental cause of many chronic diseases, but recently it has been reported to be one of the most frequent comorbidities in COVID-19 patients and is associated with higher rates of in-hospital mortality. Acute kidney injury is also known to be a complication associated with obesity in critically COVID-19 patients, and a recent study in the Diabetes and Metabolic Syndrome Clinical Research and Reviews Journal reported that obesity was associated with high in-hospital mortality and acute kidney injury in patients with COVID-19, specifically those treated by corticosteroids. Hence, the clinicians must stay vigilant on the impact of obesity and the development of acute kidney injury to disease trajectory of COVID-19 patients. Berries to possess potential ability to suppress viral infections in the pandemic. Berries are popularly consumed in forms of salads and shakes, and consumption of various nature-based products like fruits and vegetables have always been linked to benefits against various diseases due to its rich antioxidant properties. Berries such as elderberry, blueberry, raspberry and cranberries have proven to be effective against viral infections. Owing to the rich source of various antiviral constituents, berries could be an alternative source for managing viral infections. Vitamin D and its binding proteins to impact the mental health of obese women. Mental health treatment is the most neglected aspect of health. Mood disorders such as anxiety, depression, stresses and even low sleep qualities are known to be common among overweight or even obese women. A cross-sectional study has found that higher serum vitamin D3 levels was marginally related to decreased odds of stresses, but women who had a higher vitamin D binding protein level had a marginal increased risk for depression. The findings published in the Clinical Nutrition Journal concluded that this study did provide evidence supporting the fact that higher serum vitamin D may be related to decreased odds of stress, whereas higher vitamin D binding protein level is related to increased risk for depression. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.